how to cope, how to find resources, how to just exist in this new realm when it comes to taking care of yourself and mental health for you and those around you and those that you love. I want to have a disclaimer here that nothing we're going to say today takes the place of talking to a doctor or a therapist or a counselor. This is not meant to help you self-diagnose. This is just a conversation, and there will eventually be resources provided as well to help everybody kind of navigate this new normal. So that being said, Beth, do you want to introduce yourself?
Hi, thank you so much, Shanna, for having me here with you today. My name is Beth Maurer, and I am a licensed social worker here in the state of Pennsylvania. I have been a social worker for over 10 years. The first I worked in community mental health services, so outpatient services, outpatient therapy, outpatient residential work, outpatient management. I worked on a long-term inpatient program. And then I working with student assistance programs, which you may or may not be aware is a program in Pennsylvania designed to identify and link students in schools with mental health assessments and resources if necessary. And the last year and a half, it would have been 2 years, but cut a little short, I guess. I've been a school social worker in Dauphin County. So I met Shannon and some of our similar community interests years ago. And I'm excited to be here having this conversation with her and with you guys today.
Thank you. Thank you. Okay, so just some quick things to start with. I think I just wanted to touch a little bit on like what we're experiencing right now collectively as a society is not something that we've really experienced before in the last 100 years, and certainly not in the world that we live in with technology, with increased expectations on our time. And so you could be feeling any myriad of emotions. I know I certainly am as we navigate through this, from grief to loss and confusion and anxiety and depression and maybe things that you have not personally experienced before. It's normal in as much as anything could be normal right now, I think, to kind of be running the full range of emotion right now. But for folks who maybe haven't ever sought out therapy, or for folks who maybe haven't felt anxiety or depression or things like this before, can you talk a little bit about what they might be able to do to help them, you know, pin down what it is they might be feeling and then what to do about that?
Right. Thank you. I think that's a great place to start. So like Shanna said, absolutely, this is a new experience and it's a collective experience. So when we look to the people and places that normally ground us, right, whether that's a routine with our employers, whether that's our church community, those normal everyday things and those places we look for leadership and guidance are all sort of shaken up and in the air. So however it is that you are feeling, it's okay. In social work, we like to say that normal is only a setting on the washing machine. So it would be perfectly appropriate and understandable if you are feeling less settled, less grounded, and less able to follow up with maybe some of your everyday activities. And so we're going to talk a little bit about how it's important to be engaging in addressing your mental health care as well as your physical health care. We know both through science and research as well as anecdotally that those two things really work hand in hand. When we're able to take care of our physical health, our mental health is better. And when we are able to take care of our mental health, our physical health is going to be better as well. So is that a good place to start?
Absolutely. Yeah. Absolutely. So how do you do that?
Yeah. So it seems, and it's hard too, because there are the things that we normally rely on to feel well, whether that's having coffee with our friends on a break at work, or I keep going back to work and coffee, you can tell what I'm missing, whether that's our gym routine, whether that's maybe our kids spending time with other people so we get a little break. A lot of those things aren't there now. So we have to come back to what we know about the basics of wellness. Now, this is a hard one, but one that I really work to learn is that there's a difference between self-soothing and self-care. So self-soothing can be that glass of wine, that dark chocolate. Self-care is doing some of the more hard work. So what we know about basic wellness, about making sure that you are getting good sleep every night. So the things, everything they say about picking a time of day to turn off the smartphone and maybe having a little bit of downtime, whether that's reading a book or just looking at some pictures that are not on an electronic device with blue light coming at your eyes. Working it's so hard now because myself included, many of us are working from home and home has become our base, but keeping as much as we can our bedrooms more of a space for healthful rest as much as possible. So I know that all of us have probably had somebody interrupt a Zoom meeting at the kitchen table, right? But keeping our beds a space for wherever it is in your house that you find true rest and can get that consistent sleep. As much as you can, integrating movement into your day. Now more than ever is a time to dig into YouTube and see what free resources are out there. There's yoga channels, there's dancing channels. A lot of gyms for their members are sending out emails with links to free resources. So free live workouts, if that's something that you have engaged in a membership of. Otherwise, going on Pinterest and picking out a worksheet of activities to do is free, right? You can do a screenshot of that. You can print it out. You can write things down. You don't need to have necessarily electronic stuff, right? Since you're on an Instagram Live, you probably have some comfort with social media and with the internet, but getting outside and in a socially distanced and appropriate way, wearing a mask, of course, if you can't socially distance, but doing the best you can to socially distance, engaging in that, whether that's yard work, whether that's walking around the block. I think that our dog is so tired of us taking him for walks now, because that's something we do a lot of, because that's the way we've integrated activity into our day. So meditation and breathing. I think we all know that the first thing when we start to feel anxiety is our heart rate increases, our breath we start to catch, right? Now the basics of science, and certainly I forget this too, is that we need oxygen to keep moving, to keep making good decisions, to keep thinking things clearly. So a really simple one that they recommend to people is a 4-7-8 breathing scheme. So that's breathe in for 4. I'm going to do it with you guys right now. In for 4. You want to hold for 7. And then you want to blow out for 8. As much as you can. Another easy one to show kids and families is, I'm going to try to do this without dropping my phone. My laptop is set up well, but my phone is not. Tracing a square on your hand for 4 each. Counting for in for 4, out for 4, in for 4, out for 4. And that gives you the opportunity to be using your hands and integrating that physical touch at the same time while you're integrating breathing. Definitely also meditation apps. There's all kinds of stuff you can check out and download online. Drinking water. We know that there's so many things about drinking water, but we also know that in order to make it through this, we need to have strong immune systems. We need to stay healthy. We need to flatten the curve. And something like staying hydrated is really, really simple. A lot of physical discomforts, including for me, I know headaches, dry skin, all of that stuff comes from not drinking enough water. I don't know about you guys, but I'm washing my hands nonstop, so I've got really dry hands. So staying hydrated is such a basic and easy way. Being conscious of how much of those substances we consume that help us lighten up briefly, but maybe over the long term aren't going to feel good. It's hard. It's definitely nice to be able to kick back with a glass of wine. I know we probably would have been kicking off Harrisburg Beer Week. I see Colleen there. So if we're using substances, making sure we're doing that in moderation, making sure we're conscious of our consumption. Definitely okay, but making sure that we're not using something to a point. What's nice is that, and I can share this link with Colleen or with Shanna later on, is that a lot of 12-step programs and substance use programs are actually moving their things online right now. So definitely great resources to connect with in the community. Can I just keep, I'm gonna
yeah, no, you're crushing it.
So there is so much right now that we cannot control. And that is so challenging, especially, at the beginning, Shanna spoke about how we're in a current lifestyle where a lot of us are used to having control, used to having planning, right? Whether that's booking a vacation, whether that's budgeting for the next paycheck, which I know that many people are experiencing a lot of stress on. And Shanna is going to include in her links how to apply for the small business loans and support. Is that correct, Shanna?
Yeah, so every resource the state has made available on unemployment, on what to do about the new stimulus money, that will all be included in a doc that we will share. I'll share on my Facebook page, and I will also share on Instagram as well.
So really stopping and coming back to what we can control. There is a great graphic. I'm actually going to do a little one for you real quick here about what we can control and what we cannot control, and putting things down together. I'm just going to scribble this out really quick. And if we think about what we're concerned about, right, and figuring what we can and what we do not have control over in the moment, being conscious of that and taking that awareness can actually reduce some of our stress. So I'm just going to put this up really quick. I don't know if you can see it, but there's a little tiny circle about what we can control. It probably is reversed in Instagram, and a real big circle on what we can't control. And here's the trick about a lot of this. So much of this and so much of our distress comes from the story we tell ourselves about these things. So when we start to think, oh my gosh, I don't know what's going to happen. I don't know what's going to happen. I don't know what's going to happen. Right. That is distressing. But if we can stop and ground ourselves in what we do know. I do know that I have groceries in my fridge for today. I do know that we have paid electric. I do know that I can apply to get this money and get this relief for these other things that I don't know. Definitely, this is a time where that old, you guys Google and you had diaries. I'm thinking girl at my age had a diary with a lot on it. I encourage everyone to get back into journaling. Just jotting down your feelings, jotting down your thoughts, whether it's an old notebook, whether it's a notes app on your phone, whatever it is that works for you. There is something about the process of taking what's going on in your head and putting it on an external thing that allows us to process it differently. It's really kind of cool. So I know a lot of us are feeling connected through social media, and that's really exciting. And I think we need to remember to remain conscious, making sure that our news consumption is from valid and verified sources, right? It doesn't matter which side of the aisle you fall on. There are extremes on everyone. There are journalists and pundits on each side, making sure as much as we can that we're getting factual based information from sources that are as neutral as we can find. And then maybe limiting that. You absolutely have a right, and it's helpful, right? And it's so important, especially with things changing so quickly and with new information coming out, and from trying to be good and conscientious and, flatten the curve, and we're gonna hashtag mask up PA. It's so important to be conscious of these things, but we don't need to do it for hours on end, right? We can get the information we need, consuming it in a manner that we can control for like 15-minute increments, right? So for me, that involves maybe not leaving the news on where my daughter's going to ask lots of questions about the death tolls. It's going to involve me maybe going on to Governor Wolf and Secretary Levine's Twitter feeds, getting some of their stats, and then saying, okay, and maybe looking at what another neutral, news source might be, whether that's, NPR or the Associated Press, things like that. So those are some of the things.
Yeah, and I'm glad you mentioned that about social media, because I know I have an iPhone and I get the Sunday screen time report. And mine was actually down last week, but it was like only 6 hours. And it's like when your whole life is on devices, right. It's really hard to kind of manage, because I can have this open, but then I also have my email, and I have my campaign email, and I have my work email, and I have, like A, B, and C social media and all these documents I'm working. I'm like, I think for me personally, and I say this to a lot of my friends when I'm discussing kind of what we're going through right now, it's the lack of separation of space that used to exist. Like between the hours of 7:30 and 3:30, I am teaching. I am at school, and I'm only thinking about school and my students and teaching. And then, these hours I'm with my family, and these hours I'm at campaign events, or and having no barriers anymore. I would love to say that I'm still able to make a schedule and I'm going to work on these things during this time, but it's just not possible, because you never know when a little one is going to walk into the room and need something, right? And I think kind of reprioritizing. Like, I'm a parent first right now, and then I still have to be a teacher, and I still have to be a candidate. But then I still have to be me. And so I know a lot of us are trying to fit things into boxes that aren't there anymore. And social media is a blessing and a curse, because it's nice to connect with your friends. It's lovely to be able to do stuff like this. But if you're scrolling for hours at a time, it can be downright depressing. So I'm glad you brought that up.
Yeah. So I think that's so important. I'm just going to drink real quick.
Oh, sure. Yes. Stay hydrated.
Yeah, stay hydrated. So what I think is so important when we talk about mental health, when we talk about our wellness and just caring for ourselves in general, you really hit the nail on the head, Shanna, is the concept of boundaries, right? So we know that boundaries, I like to explain boundaries when I'm working with people to sort of like the fences that we construct to keep us safe, whether to keep something out or to keep something in. There's a great quote out there, and I apologize, I don't know who to credit this to, but it's boundaries are the distance at which I can love you and me simultaneously. So when we talk about these boundaries that previously existed in our everyday lives, whether that was a work schedule, whether it was our kids being away on a schedule, whether it was, even the spaces in our home, like I mentioned earlier. So kind of coming back to that idea of, can we put a line around when we're going to look at something, when we're going to engage in something. For those of us who are working from home, and I keep referencing that because that's, again, sort of the world that I'm navigating right now. Maybe shutting down the work laptop or shutting down the work portion of the laptop if you're now also homeschooling on that laptop at 5 p.m. every day. I know that we're all many people are trying to navigate the expectations of their school districts and as well as independent, maybe enrichment activities, or just keeping your kids from fighting with each other. That's another option. But again, setting a time on what you're going to do. That's one of the things, it works. It was such a great segue, because one of the things I was going to talk about a little bit is about trying to have a schedule. Do you need to have it done out by like a graph by the hour? Absolutely not. But maybe like something along the lines, I know in our house, for example, it's gotten into, okay, we want everyone to kind of like be up and start moving by like 8 o'clock, 8:30. We kind of want everyone to be dressed and fed and moving and moving in the direction of a productive activity by 10 o'clock in the morning. Maybe we have lunch at the same time every day. And after that, whenever we finish, we have half an hour of maybe non-device time or reading time or quiet work time. Maybe, there's a reason that all these platforms are utilizing all these things, like Disney releasing Frozen, for example. All these things are being released and launched for us and for our kids, and that's great. Maybe setting like 2 to 4 p.m. as that time that the kids can kind of kick back and do some of that, and we can get some other quantitative, measurable stuff done in our lives. But again, having a schedule, and then that's a way that we have a small amount of control over something in our lives. So can we control all the things that are going on out there? No. But in some measure, we can set up a structure, and we function often when we have that structure. And that's why I think so many of us are struggling right now, because those things that moored us and anchored us are no longer in place. So looking at what we can cultivate in our own spaces, in our own lives, will help us to have some control in that time.
Yeah, that's exactly, I know that's exactly what I'm experiencing, is like not being able to put things neatly where I think they belong. Yeah, and now we're doing that as an entire globe of people. Everyone is navigating kind of the same thing. I can only imagine if this were all to end. I keep seeing, they want to reopen the economy and like, what's it going to look like when that does happen? I still don't think we're going to be normal for quite some time. So like, how do we transition? I don't want to say transition. Let me think of it this way. How do we set these goals and boundaries when we don't have a realistic time frame? I think that's something I'm struggling with too. I know today we finally saw that school is being closed for the duration of the school year. I know that was a great stressor for me, because as a teacher, I have to plan instruction, and am I only planning for 4 weeks, or am I planning for a whole quarter? I have a student, my son is a kindergarten student, so same thing, trying to figure out like, what is this going to look like now, knowing that we're not going to have the closing of school year activities. I'm not going to get to have a concert with my band kids. when do they get to see their teachers to say goodbye? Those things are really having to navigate on your own, let alone try and guide a small child through.
Absolutely.
So like for me, I know I have a hard time trying to figure out like how to get myself out of this. Like I'm trying to think of it like it's not long term, and I think maybe that's part of the problem. So at what point do you realize like maybe the feelings you're having are more than what you can manage with internet yoga and taking your dog for too many walks? Because I think a lot of people are going to be able to manage that way, but for a lot of us the disruptions are a lot bigger, they're a lot heavier. So like when do you know it's time to take maybe that next step and get some help?
I think that's such a great point, Shanna. So many folks might already be experiencing this new challenge in the context of already having a diagnosed mental health disorder, maybe, or already having experienced an episode of depression in the past, some anxiety, things along those lines. So I also want to say too that we've talked about this being a collective trauma that is impacting our entire globe. And if someone has experienced trauma in the past, very much another trauma can be very triggering or activating. Activating is probably a better term to utilize, but really bring up those feelings of lack of control, of danger, of concern. So, as a general rule, we look at the duration, so the length of time that someone is experiencing a struggle, okay, and how it has impacted their life. So we are all living in a brand new existence and a brand new normal. So in an everyday world, all right, I'm just going to use myself as an example. I would get up and go to school. I work as a school social worker. And so it's important that as part of my self-care and as part of my professional presentation that I, shower, put myself together, and get dressed every day. If I started going to work wearing sweatpants every single day, obviously I would be in trouble, and that would be a concern. That would perhaps be an outward symptom that maybe I'm not functioning as well as I can. In this new work at home world, I put on pants with buttons one time a week. So that is no longer a way to judge that. So we have to use a new set of standards, right? So let's look at, are you sleeping and feeling rested, right? Are you able to eat nutritionally every day? So looking at, and we'll put up some of the information in our resources that Shannon and I are going to share out later on, looking at what the signs and symptoms of depression or anxiety might be. And again, looking at how it's impacting your functioning. So self-care and putting yourself together looks different when you're working at home, but are you still attending to your hygiene? Are you still attending to your nutrition? Are you still attending to your rest? Being stuck in the house with the same people all the time leads to some irritability. Are you getting irritable occasionally, or are you yelling at everybody in your house all day long? So like anything else, it's a spectrum. It's definitely appropriate and fine to reach out and look at getting some additional support during this time. If you had any concerns about the foundation of your house, you would call in an architect or an engineer and work on, supporting the foundations of your house. And this is a time where that might be necessary, and that's perfectly fine. And these resources are out there and available for that. But does that make sense about looking at the level of functioning and the level you're able to engage?
Yeah, certainly. And I think for a lot of folks who were maybe on the fence before all this happened and already maybe having a difficult time managing things, myself included, having too much on your plate, not always being able to feel like you can accomplish what you think you need to, the added stress of the environment we're in, it's just like the icing on the cake that no one wants to eat, right? So it's just knowing when it's time and when it's okay, and when it's expected. I know I've seen countless reports about how, the calls, sorry, I think my volume's being weird, calls to crisis helplines have skyrocketed during this time, as a lot of people are dealing with economic anxiety, like you said, being stuck in your house all the time, or having to work and not having the luxury, like it's a luxury, but like not having the chance to stay home when everyone keeps telling you need to stay home. I know that it's presenting differently for everybody. So again, we'll share those resources in the document. Sorry, I don't know why my volume's being weird, if you hear that too. But yeah, I just wanted to make sure that we're touching on everybody's going to experience this differently, and what may be a warning sign for one person could be way past the warning sign for somebody else, if that makes sense. Okay, what do you think? Do you think we touched on our list here?
I kind of just want to touch real quick on like people staying connected and about, making sure we're supporting our kids and their mental health and all of this. I know that's a concern. I want to address that, but I also want to sort of alleviate some fear a little bit. I saw a friend had shared an article on Facebook about, our kids are having this loss. Kids are missing out on this. And yes, I agree. Our kids are missing out on a lot of experiences. Our young kids are not getting those beginning experiences. And certainly my heart is really aching for seniors with proms and graduations and all those things. But I think it's really important to add this caveat when you are concerned about your children, okay? All of the research around trauma and resiliency indicates that the number one factor is to have at least one consistent, supportive, positive, caring adult in a child's life, and that significantly promotes resiliency. So if we are consistent parents and able to worry and care for our children, we have already started that process. We have already been somebody, right, who is in our kids' lives and able to be supportive and consistent. And that is not to diminish the struggles your kids are experiencing. That is not to diminish that they might be having some additional anxiety and depressive symptoms about this. That's all. But I just want to alleviate everyone. I just want to put some calmness towards that for the most part, it's going to be okay, right? So again, the things we can do for our kids in this time of uncertainty. It's challenging for them because we have all of our life experience. We know that bad things can happen, and we know that we can make it through bad things. And kids don't necessarily have that backdrop, that background information to know that they've made it through things. They can see the disappointment. I have to say, my daughter is really worried about an Easter egg hunt. And she's annoyed that I didn't buy her a new Easter dress, which, true confession, when things started closing down, I was like, I'm not spending money on a dress because I don't know if we're going to have an Easter service. So that's what she processes as the most important. I feel bad that we're not spending that time with her families, but she's really worried about the Easter eggs. There's a cute letter going around online, by the way, saying that the Easter bunny is considered essential. So I saw that. Yeah. If that's something your family engages in. So what can we do as parents, as adults, as professionals? So I know a lot of you are suddenly working. Teachers maybe could be with your kids in their classroom when they were having a hard time. And now you're like, how am I supposed to handle what I'm hearing? The most important thing we can do is listen to them and acknowledge and validate. Like, yeah, that is frustrating. This is scary. This is brand new. I hear what you're saying and your feelings are valid and real. We don't want to minimize their disappointment. Like, it's not that like prom wasn't that important. People, it's important to them. It's their experience and it's important to them and it's a loss for them. But hearing it and validating it, yeah, we really wanted that. That was going to be so special. Man, I'm sorry you're going through this. Creating virtual opportunities for socializing. I think many schools are doing a great job with classroom meetings on Zoom and things like that. Online video chats, FaceTime, that kind of thing. And again, for kids that have existing mental health conditions, making sure that you are definitely engaging in what you need to do, making sure they have a sleep schedule, an eating schedule, physical activity, making sure they're accessing medication. Thank goodness, pharmacies are still essential. And being cognizant and being in touch with a clinician if your child or a team that you're working with is currently accessing mental health services, making sure as much as possible. So most mental health clinicians are still working. They are considered essential, and most of them are charged within the ethics of their profession to not, quote unquote, abandon clients. So doing what they can to make sure that if they are unable to practice for whatever reason, their clients are being directed on other resources to utilize. But that's a big thing about avoiding client abandonment ethically. And from an insurance perspective too, If that's brand new to you, calling the number on the back of your insurance card will give you, and you can speak with a representative to get information about a clinician in your area that takes your insurance. Additionally, and I'm including the link for Shanna, the Psychology Today website is a great way to put in what you're looking for, who your insurance provider is, and what your area is, and they will provide a variety of options. And again, that person might not have openings, might not necessarily be doing telehealth, but out of 20, you may be able to find somebody that's a good match for you. And again, we're including if at any point in time you or anybody you care about is having thoughts, plans, or urges to hurt themselves or hurt anybody else, or making statements of that, not hesitating to call crisis intervention, not hesitating to call 911. Yes, those are busy resources right now, but they are resources in the community, and they will be available and help during that crisis.
Absolutely. Again, I know a lot of people are afraid to take advantage of things because of cost, because they're afraid to even be out right now, to go to hospital, to utilize emergency services. But in an emergency, that is still your best line of defense, for sure, to protect people, including yourself, that may not be able to protect themselves. I know we've talked about that in other respects too. We've had these discussions before, not in the context of a global pandemic, but you may not always feel like they're going to appreciate it in the moment, right? Because maybe they won't, or maybe it's you. But it's always better, always better to, I mean, there are resources out there. It's not easy to use them in some cases, but to not be afraid to use what is there for us, I think is really important. Okay, so we are, like Beth has mentioned, working on a full list out of resources for things that we've talked about today, things that you can share with folks, and I will put that both in the Facebook event, which did not work today, and on the comments for this post. I will make sure that that is widely available. Feel free to share that with anyone. It will have some regional and some more broad resources. I've included the pa.gov guidelines for individuals, which we mentioned earlier includes unemployment and how to navigate normal, like everyday things that maybe we don't have access to anymore. And also the Department of Health website on getting mental health resources when you need them. We have an article here that I know I shared on my personal page a week or two ago about grief, and how we are experiencing this collective grief right now as a society. And then some of the other references that Beth has already mentioned will be included on there as well. If at any time anybody has questions, you're free to post them on here, and Beth and I can be back to you with answers, or point you in the direction where you can get answers. If you have any closing thoughts, I'm so grateful that you took the time to do this today.
No, thank you so much. I really appreciate the opportunity to talk about something that I feel passionately about. And I think many of us are feeling a little bit helpless right now. So to be able to be a part of the community and to continue in some small way sharing some resources that might be of benefit is fantastic. And like Shanna said, she and myself are available. I'm also including in the document that Shanna will be sharing out both Cumberland and York County's crisis intervention contact information. We'll make sure to include the national numbers as well as the text hotlines in that time too.
Absolutely. I'm so grateful for the texting option, because I think, I know I'm seeing so many more texts from like any kind of civic organization I've ever been involved in. And it's nice because you can kind of utilize that on your time and not have to wait on hold or whatever happens when you're, and I have a hard time actually dialing a phone number. If I can text, right. Fine, right? So great. I want to thank you again for taking the time to do this. Sorry about all the tech glitches. And then we'll be in touch and we'll get that resource sheet out to you guys today.
Thanks so much, guys. Take care.
Thank you, Beth. Have a great day, everybody.
Bye. Bye.